Hello, I'm Dr. Jerry Budd. I'm the Assistant Dean of the Family Nurse Practitioner program at the Harrisburg campus of Widener University. On behalf of Widener and the School of Nursing, in particular our Dean, Deborah Garrison, and our Director of our Nurse Practitioner program, Dr. Shirley Drayton Brooks, I'd like to welcome you to being a preceptor at Widener University. We highly value your expertise and appreciate your willingness to help the next generation of family nurse practitioner students. We have a very rigorous process for choosing preceptors, and please know that you have met all of the criteria, and we will continue to ask that you provide us with updated information about your licensure, your malpractice, and your resume for our files so that we are able to verify to our accreditors that we have preceptors who are well prepared to help our students through the learning process. As a preceptor, it's important for you to know a little bit about Widener University's FNP program. We've been around for many years. It actually started in 1995. We have almost 175 graduates, and many of our graduates may be preceptors themselves, so you may be one of those, and I welcome you and let you know how much we appreciate your hard work in educating the next generation of nurse practitioners. We know, those of us who do clinical teaching, it's not easy. It's not easy to have students with you when you're trying to fulfill your duties of seeing patients. Our students in the Family Nurse Practitioner program have 564 hours of clinical time. They progress through 3 semesters of clinical courses. During that time, they have didactic class time where they're reviewing and learning about history, physical exam, the assessment and differential diagnosis of patients. And as they move through the first and second semester and definitely into the third, they begin to be able to develop a very fine-tuned plan for each individual patient they see. Widener University is a metropolitan university that takes great pride in engaging students in an active learning process. Particularly at the graduate level, we have high expectations for the students, and we expect that they are acting professionally at all times and that they are participating in their learning and taking responsibility for directing what they need to learn and how they best think that they can get their needs met. So you may hear them ask you questions and elicit information from you regarding what they need to know. I'm sure that you probably will be able to easily participate in this with them. In terms of our mission, we lead by having a unique combination of liberal arts and professional education in a challenging, scholarly, and culturally diverse academic community. We inspire our students to be citizens of character who demonstrate professional and civic leadership. And we contribute to the vitality and well-being of the communities that we serve, and we expect our students to also be very active in their communities. Through the learning process, we expect that by the end of the program, the nurse practitioner student will be able to synthesize theories from all different types of disciplines, such as nursing, behavioral theories, from scientific, natural science, to support the advanced practice role development and to meet the diverse and complex needs of individuals, families, and communities. We believe that students will be able to effectively use oral and written forms of communication, and in particular be able to be proficient at using electronic technologies for consumers and communities. We expect students to be open, interactive, and collegial, and to consider the diversity of background and experience of both their peers, their colleagues, and their patients. By the end of the program, students should be able to demonstrate creativity, critical thinking, and diagnostic reasoning skills in clinical decision making. We expect that they will be able to identify, evaluate, and manage the health needs of consumers. Definitely by the end of the program, we expect that students will be engaged in student scholarly activities, including the use of theory research, and with the purpose of advancing practice and evaluating the outcomes of care. We believe that cultural competency is a important goal of all healthcare providers, and we expect our students to work hard to develop their culturally competent care. We also believe that demonstrating creative leadership to guide practice and advance healthcare is an important component of a graduate of Widener University. And we expect that students will promote, maintain, and restore health in collaboration and consultation with the consumers and other healthcare professions. And they'll do this through using assessment, planning, implementation, and evaluation of care, and also working in a multidiscipline environment. And of course, engaging in moral and ethical decision making from both a personal and an organizational perspective is vital, and that we expect them to adhere to professional standards of practice at all times and to codes of ethics and accountability for practice. And we believe that Widener provides access to continued professional and doctoral education for all the students. Preceptors can expect that students will have at least one, if not most probably two, site visits each semester. Because oftentimes a student is in two different sites, might only have one visit to your site. While we do a clinical site visit, we prefer to observe the student directly in engaging with a patient and performing the history and the physical, and then giving you the patient presentation or report about what their findings in the history and the physical and in regards to their assessment. And perhaps even as we move into the later half of the second and the third semester, to be able to develop a fairly clear-cut plan of care for that patient. So we will enjoy observing the student do that for probably a couple of patients if the schedule allows. We're always aware that the time and disruption that our students can, and particularly when faculty are there, can cause to a clinical setting, so we try to take that into account. Additionally, you'll find that you're asked to complete 2 clinical evaluation forms on each student that you have, one in the mid-semester and one at the end of the semester. We do ask that you do this so that the evaluation can get back to this faculty member so that they can discuss it with the student and make appropriate plans if any adjustments need to make or additional remediation needs to occur at the midpoint or even at the end of the semester. We welcome your input at any time, though, and it should not be limited to those 2 evaluations. We try to make ourselves available not only to students but certainly to preceptors, and to have you contact us at any time, either by phone or by email. So again, on behalf of the faculty at Widener University School of Nursing, we want to thank you for your continued dedication to our students and your willingness to provide them with continued excellent clinical experiences